All right. Hi, everyone. My name is Debbie, and I'm from the Healthcare and Science Career Community here at the Career Center. I am here today with the Paul alum, Rebecca Chacón from AMITA Health, and we're here to talk about her career journey. Rebecca, thank you so much for taking the time to talk with me today.
Absolutely. I'm so honored to be here with you.
Cool. Can you explain to us first what your job is and what you do on a daily or weekly basis?
Absolutely. My current job is with AMITA Health, and I'm working on um, or managing a grant funded program for them that has two focuses. One is working with pre-diabetic and diabetic patients, and the other is working with substance use disorder patients. And really, the goal of this program is to continue to push forward initiatives to move in the direction of value-based care in healthcare. And so it is a preventative and also intervention-based program for these two different populations of patients, and really looking at their lives in a very holistic way, looking at the various social determinants of health that are affecting their lives, and really using community health workers at the primary clinic level to try to create these interventions for patients to help address any issues that they have in their lives.
Cool. And so then what are some of the things that you might do on a daily or weekly basis?
Yeah, so I actually function in a player and coach role, which is something that was new to me. I had not really heard of that before. But really, what that means is that I am managing our entire program while also getting to be a community health worker at my own site. So I love that because I really get to have a hands-on feel for this role and for getting to have direct interactions with patients myself, while being able to use that knowledge to help train and better prepare my staff and really understand sort of what they're going through on a day-to-day basis, and helping them make sure that they have, wonderful interactions that are very impactful for themselves while they're working with their patients as well.
Can you take me through kind of your career journey since graduating from DePaul and kind of how you came to this job at AMITA?
Yeah, my first position after DePaul was actually with the Health and Human Services organization in Rogers Parks on the north side of Chicago, where I started as an assistant program director for a city-funded after-school program. From there, I went on to become the program director. Unfortunately, that program did lose city funding. So after that, I went on to become a provider manager at a boutique childcare agency, where I was basically interviewing childcare providers, many interviews every single week, and then doing ongoing management for our about 1,000 providers in our database. And I was working there for about 3 years. And from there, I went on to start an initial role at Make-A-Wish, Illinois, as our referral coordinator. So I was helping families understand sort of our eligibility criteria, doing some sort of walking families through our process, determining eligibility often over the phone with families, and letting families know when their child's condition was eligible for a wish, and sort of guiding them through what the next steps would be. From there, I was promoted to our community engagement manager position, which was a brand new position at the chapter that was really focused on extending our reach within the city to underserved areas of Chicago where we know there are high, concentration of children. And potentially, many children being diagnosed with life-threatening medical conditions that weren't being referred to our programs. So my job was really to find different ways to connect with those families and those children to get them referred to our program. And through that, I got a lot of experience working with different community health workers in different neighborhoods of Chicago. And that sort of made me realize that that was something that was very interesting to me, sort of, health at that community level was something that, I really wanted to play some sort of role in. And I was lucky enough to come across, this opportunity with AMITA Health to be able to manage this program for them. And so I have been here now for just a few months, still settling in, but it's been a great transition so far.
Cool. Thanks for walking me through that journey, kind of through
Mhm.
the different parts of your career. So we know that you're new to your role at AMITA Health, but what do you find most rewarding about your work, and what do you find to be most challenging?
Yeah, I think, it's just really rewarding being able to have that one-on-one interaction with patients. And sort of just seeing, them being sort of surprised by someone asking them about all these other aspects of their lives and offering, to help them in any way that I can. And I think knowing that I'm building a team who are out there doing the same in the city, that's great. That makes me really proud of the work that we're doing. I think what's challenging is sort of similar. It's hearing about all of the challenges that people go through, especially within, our healthcare system in this country. It can be really challenging for a lot of people. Um, and so that is, definitely it's bittersweet, because I can help, but it's also just hard to hear about some of the things that people have to go through.
Sure, I can imagine.
Mhm.
Um, it's, yeah, good to hear that kind of it's both a reward and a challenge of the role.
Mhm. Yeah.
I'm curious to go back a little bit to your DePaul experience.
Mhm.
If you could talk a little bit about some of the impactful parts of your undergraduate experience. So this could be a job, a class, research, internship, student organization, kind of anything that sticks out to you.
Yeah. I think that I definitely used a lot of the opportunities, and I think they were some of the seminar classes that we
Mhm.
had where we had to take on internships.
Mhm.
And, I've always been someone who has a lot of passion for working with nonprofits, but, I think that was really solidified for me through a lot of those internships that I had during my undergraduate career. And getting to really experience that, before really entering the workforce was really great. Um, yeah, and then I think, I was part of a lot of student organizations, one in particular throughout my 4 years. And, that was just always one of my favorite experiences also of, looking back to my time at DePaul.
Sure.
Mhm.
What advice do you think do you, I'm sorry, what advice do you wish someone had given you when you were in college?
Yeah, I think it was to take some of the pressure off of myself to have everything figured out, because I think that there's often this idea that we all have this pressure that we need to know exactly what direction we're going in and what's going to be our next step. And, I feel like so many things that I've experienced in my professional and personal life have felt just so organic, and those organic changes were the best ones. And so I think that it's good to be prepared, it's good to plan, but also just be open that things are going to happen organically, and often those will be sort of the best steps to take. So yeah.
Absolutely. We often tell students, like, you can come talk to the Career Center even if you don't have everything figured out. Like, sometimes
Mhm.
students think you have to have a plan to come and talk to us, and really, no one has a plan. So, or we can help you
Exactly.
come up with one. Um,
Right. And
what
sometimes you look back and, things have occurred in ways that you never imagined, and so yeah, I think that that's one of the most exciting things about life, right? Is that you don't know what's going to come next. And that can be scary, but it's also exciting.
Definitely. Good reminder that it's exciting.
Mhm.
What advice do you have for students who are interested in exploring a career like yours in community health?
Yeah, I would suggest that, getting out there and trying to get as much, hands-on experience is a great idea. I think that a lot of courses and classes can give you some groundwork, but nothing really prepares you or gives you the experience like just getting out there working with patients, with community members, whether that's volunteering, an internship, or trying to find a position maybe over the summer during breaks, where you can gain some of that experience, that will really, really just be so enriching. And I think if someone is unsure still, if that's what their passion might be, that'll be a great way to figure that out.
Sure, absolutely. I
Mhm.
think that's great advice. Um, so last question, when we have another interview again in 5 years in 2026, what do you hope we can talk about in terms of your career?
Yeah. I would hope that I don't know. That's a good question. Um, I hope that I can continue to move forward and, build onto my career, whether that will continue to be within the healthcare industry. Who knows? That would be amazing. But again, I think I have very much gotten comfortable with the idea that I'm like, no one knows what's going to happen next, right? And so I'm kind of open to whatever that might be. But I would hope to be working somewhere, perhaps, as an executive director of some sort of organization that is working towards health equity. And hopefully, some issues that we have now will be far less of an issue for people, and maybe we will have achieved some more health equity at that point. So that's my biggest hope for from now until the next one.
That's cool. Thank you. Well, thank you so much, Rebecca, for sharing your career story and for inspiring current students with your experiences.
Yeah, thank you. It was my pleasure. Thank you so much.